Hello. So for these videos, I think broadly, kind of thinking of all of them, I think I would say I was challenged kind of socially and culturally. Just thinking of America as a society, we're very fast paced. We're very, like when we want something, we want it at the snap of a finger, We're just that kind of society where we're not accustomed to having to wait a super long time for things. And I think that's applied to our healthcare. And these videos kind of, discussed kind of along those lines. It just kind of got me thinking, like, physician burnout and stuff like that. America's so fast paced, we want things, but then we complain when we get things too quickly and we have to pay more for it. Or, we complain when we only get 15 minutes with the doctor, but it's not the doctor's fault that they're having to see as many patients as they can to get more money. So, I guess broadly, it kind of got me thinking about how the system is a lot like our society, but the system does not connect to our society. The system, is set up right now to get as many people in as you can during the day and, to just send them on their way really quick, efficient appointments, but that's not really what we need in America. So it just kind of got me thinking along those lines of, our culture. And then the video, Can Equitable Care Improve the Bottom Line, kind of got me thinking emotionally, because it talked about how, it was a short video, but the woman talked about how minorities have worse health outcomes, which is something we've discussed in many classes. It's not anything new that I haven't heard, but just kind of when you keep hearing these things reiterated, it really sticks in your brain. And how minorities have higher rates of readmission, longer lengths of stay, those kind of things. When you think about it, there are so many minorities that when you think about it in a health terms, they're almost kind of a majority. And so when you hear about bad things happening to the minority, you're like, well, that doesn't only apply to one minority, that applies to probably almost all minorities that fit into that bracket. And it's just kind of hard and emotional to think about, frustrating that so many people out there are not getting the care and quality of care that they deserve, and it's making them sicker. It's making them unhealthier. And it's very frustrating to think about that. So some topics that raised my concern or caught my attention, the video, How Can You Apply Clinical Skills to QI, kind of talked about physician burnout and how clinicians are, being burned out over having to see these mass amounts of people. And it kind of talked about the cycle that, they go through, where they meet a patient, they, find out what's wrong with the patient, get the patient on medication, and then have more visits with the patient in which the patient brings up, how displeased they are with how much they're having to pay and all this stuff. And really, the physicians are getting burnt out from that, but then how can primary care be more fulfilling? Talked about how primary care has become a not happy place for physicians, and that's the words they used. And it's more of an assembly line and not rewarding. And I think a major drive for people to go through the school and all the time and effort it takes into being a doctor, to not have it be rewarding, is a really big issue. And I think primary care has, all the opportunities to be very, very rewarding work. But I think about when I go to the doctor, I maybe see my doctor for 8 to 15 minutes, and they just have a line of people all day, and I can see how it's like an assembly line. And so it's concerning to think that physicians are starting to, not want to go into primary care because a lot of people go to primary care providers. So that's going to cause a physician shortage, which we talked about a few weeks ago, actually. So, that kind of raised some concern that we talked about it a few weeks ago. We're seeing it here. It's an issue. It's a reoccurring issue. It's not going away. And maybe part of physician shortage is physician burnout and them not wanting to go into primary care positions. Another thing that kind of caught my attention, raised some concerns, was how they talked about waste in hospitals and how they're managed as cost center, and how they want to get rid of waste, but the people that are getting rid of the waste aren't the people that are working there every day that they should talk to about what's wasteful. He said you can go into any hospital, anywhere, talk to people on the floor and go, what are 5 things that, we could be doing differently, more efficiently, and they'd give you 10. So it really tells you that higher ups are probably not listening to the people that work for them and really taking their advice into their hospitals. And then they also talked about improved care for minorities equals improved care for all. And I think that's a concept that a lot of people don't understand. They're like, well, why do minorities need better care if they're getting the same care as us? Well, number one, they're not getting the same care as us. And number two, improving care for any class, minority, cultural, improving care for anyone improves care for everyone. So, like, it's not going to take care away from you. It's going to improve their care, in turn improve your care. And so that kind of, that thing they said, it was in the video, can equitable care improve the bottom line? I think that kind of stuck in my head because I think a lot of people don't think about it like that. Like, you improve care for minorities, you improve care for all. And so that really stuck with me, probably the most impactful thing from all the videos. And another thing that kind of stood out with me was from can you identify and confront workarounds? And I didn't know what a workaround was, but I kind of got the gist. It's like a clinical cycle, and it's like work, and then it leads to what went wrong, why did it go wrong, how can you change it, and then work again. And you keep completing that cycle until you come up with a system that doesn't have a lot of things that go wrong, and then you share that cycle with others. You come to a solution, you share that solution with other hospitals, other workplaces, and then they can do those cycles and kind of filter things out. And by doing that, you save money, time, work power, everything. And so that kind of also caught my attention as well. So these videos didn't conflict with any beliefs I had. I mostly just learned a lot about, about physician burnout, about minorities, about primary care, and about waste in hospitals. It didn't conflict with anything that I previously learned. It was more just informative. A question I did have was from the video, how clinicians balance overuse and fears of litigation. And they kind of did branch over malpractice and like over-ordering tests, or something. And then they also kind of talked about care redesign and owned by people that work inside of the healthcare delivery system. It wasn't so much a question of what is it, I understood it. It's more a question of if that is an idea that's out there, why isn't that being more broadly focused on? Because I think it's a good idea that you want to have places owned by the people that work inside. Because how is the owner going to know what's really going on in a hospital or a workplace if they're not there sometimes? And so malpractice I know what malpractice is, but that did kind of confuse me with how it fit into that video. But I definitely, the care redesign, I think, is a really cool model idea, and it did kind of stick out to me. And then, so the issues kind of mesh with my past experiences. They talked about minorities having worse health outcomes. It related to a lot of class lectures, especially in HS 400 that we've had, about like why certain minorities are doing worse in certain areas. And so I kind of related it back to those classes, taking some of that information and applying it, like the social determinants of health, like the people, like income and social and economic status and all that kind of stuff. It kind of connected to that. And then I can also relate by, just being an American, going to the doctor, having to sit through doctor's office appointments and stuff. And so they were very eye-opening videos.